Good morning. This is the OHSU Effect. Let's get started with Dr. Kent Thornburg, the founding director of the Heart Research Center at OHSU. Hi, doctor.
Pleased to be here.
Okay, so you practice something called developmental origins of health and disease. I don't think a lot of people have heard of that, so explain what this new science is about.
This is a really exciting new aspect of medicine. About 20 years ago, David Barker discovered that people who were born small had a higher risk of having heart disease and dying of it later in their life compared to people who were born larger. And that led us to understand that the way you grow before you're born is important in determining your risk for having disease in your lifetime. And all of these diseases now we know are related to the way we grew early in our life. We call it the first 1,000 days because it's the first 1,000 days or about 3 years after you're conceived. And during that time, the nutrition you get from your mother makes a big difference on the way you develop your body, and that determines your likelihood of having disease as you get older.
Wow. In what way will this science change the practice of medicine?
At the moment, it hasn't changed it very much because the medical community is hardly even aware of it. Unfortunately, it takes a long time for science to be able to develop a base of knowledge and translate that so that doctors understand it and use it in their practice. And that has not yet happened. But what will happen is that we will come to realize that we can characterize the way a person grew before they reached adulthood and use that pattern of growth to determine what kind of medicine and nutrition they should have later in their life to stay healthy.
What role do public health agencies play here?
Public health agencies are extremely important. Most people might not realize it, but the health of the community, that is the overall health, the average health of everybody in our community, is determined not only by their access to medical care, which is what we usually think of, but actually their access to good nutrition and to an environment in their communities where they can live healthy lives. They have to be in communities where they're not always stressed, where they're not too poor, and where they don't have access to good food. So this will drive public health policy in a way that we haven't seen before.
But it sounds like it's really far off in the future, and it could take a long time to build these more sustainable and livable communities, yeah?
Well, I'm sorry to say that that's true, but what we know now is we have to get to this. And that means that people in our community now have to begin to look at the importance of nutrition in determining the health of our entire community. So we've seen diabetes and obesity, and we expect heart disease to go up dramatically in the next few decades. And that's because we've been having poor diets for the last 2 generations, and we can't continue this.
You mentioned your colleague, Dr. David Barker. You guys are longtime collaborators. So what is the focus of your research currently?
We are looking at 2 levels. One level is what we call epidemiology, and what we do is we look at the way people have disease now, and we correlate that with the way they grew early in their life. And that's how we're discovering that the developmental origins, we call it, the growth origins of disease, represent diseases ranging from heart disease, diabetes, several cancers have been discovered now, and osteoporosis, especially in women. That means that the early life is the time when we need to take care of people in our population so that the health of the whole population will get better. Can
that be reversed? If, unfortunately, a child doesn't get good nutrition, but later on in life takes it on as their own, can it be reversed?
Well, we believe the answer is yes. We believe that it's important that, especially if a person was born small, that they have good nutrition and they take care of themselves. They have to be more careful because they're more vulnerable for disease than people who are born larger. Now, there's one caveat to this, and that is that babies that are born extremely large, that is over 9.5 pounds, they usually have mothers that were diabetic or had poor insulin control. And in that case, they are extra large but not protected from getting these diseases, and they're more likely to get the diseases that the small babies get.
Interesting. Have you done any research in premature babies? Does that relate to any diseases later in life as well?
Well, you mentioned this big Congress that we're having here in Portland coming up, and I'm going to plug it right now because one of the subjects of this conference will be to talk about what happens to premature babies. We don't know as much about premature babies, so we need a lot of work there.
Well, are you doing any clinical trials, anything like that?
We're doing a lot of clinical studies, and we are planning to do another big one in Oregon to study the diets and the bodies of women and how those diets and body compositions determine the growth of their babies and the outcome of their babies after birth. And that'll be coming up in the next year or so.
So it sounds like this is a very long-term trial because you have to find women who are pregnant or getting pregnant and then stay with them, right?
Yes. In fact, what we want to do is find women who are not yet pregnant, planning to be pregnant, so we can study them at the time they become pregnant, all through their pregnancy, and study their babies for a year or two after.
You said that could start within the next year. Are you looking for people? Can people sign up if they're interested, or how do you go about doing that?
Well, we haven't opened the recruitment for this yet because we haven't gotten the details of how it will be funded. We scientists don't have automatically have the money for these things. So we usually go to big organizations, foundations, and the National Institutes of Health and ask them to help fund these so that we can have enough money to have the personnel to do it.
Well, let's talk more about the big conference that's starting tomorrow. People are coming from all over the country, right?
Yes, there is a big conference, and if your listeners don't know about conferences, they also have what are called satellites. So when a big conference comes to town, like we're doing beginning on the 18th, there are several satellite conferences that are also being planned around it, 2 or 3 before the meeting and some after, to study different aspects of this same problem.
Can you talk about some of the things that you'll be discussing?
Yes, one of the things I didn't mention is that there are really 2 ways that babies are affected when they're growing in the womb. One is that if they don't have adequate nutrition, they can't make their organs as well. So they're not as strong, and that's why they get disease later. And the other thing is that their genes are turned off and on differently. So the hottest area now in our science really is to find out how these genes are regulated, and perhaps someday we can reverse those when we understand how they work.
So it seems like we really need a lot of maybe parenting classes or nutrition classes for parents to be. Does OHSU offer that? Do other hospitals offer that, parenting classes and things like that?
Well, not as much as should be done, and I think part of the reason is the message that we're now giving hasn't really gotten out to the community yet. We need now for people to learn how to cook well, how to buy the right food, how to eat wholesome food, and to get away from junk food. This is a big change in our culture that needs to take place.
Dr. Kent Thornburg, thank you so much for being with us. It's a great topic.
It was certainly nice to be here.